Hello and welcome to InnoHealth Magazine podcast. I am your host Soumya Singh. Today we'll be discussing how technology is changing, how the accessibility is changing in the healthcare field. To discuss this, we have a very special guest with us, Mr. Surjeet Thakur, the founder and CEO of TrioTree Technologies. We welcome you, sir. We are thrilled to have you, sir, here.
Thank you. Thanks a lot.
So, how are you, sir?
I'm very good, ma'am. How are you?
So, I'm also good, and I would like to start with the company TrioTree Technologies was founded in the year 2012, if I am not wrong.
Absolutely.
Yeah. So, what was the journey was like? How you find any personal experience, or was any gap that you find that you have that notion that I need to do something in healthcare technology?
Yeah, ma'am. So I come from a technology background. I did my BE in computer science from Punjab in 2000, and I was recruited in the campus, but 2000 was when there was a Y2K boom and all the jobs were going.
Yes.
So my joining in the campus got delayed. So I used to stay with my brother here, and I used to wait for my turn to join the campus. And during that time, because the delay was almost for 3-4 months, my brother said, why don't you start something? At least start going to somewhere, and rather than just being at home, you start working somewhere. And that's when I joined Max Healthcare. Max Healthcare had just started, and I went and joined their IT department.
Okay.
And that is when my love for healthcare started. So for almost 9-10 years, I worked in the hospitals. I worked with Max Healthcare as one of the founding members. Then I moved out. I went to American Hospital Dubai.
Okay.
And American Hospital Dubai was the first JCIA hospital outside US. So there was a lot of learning for me as far as hospital is concerned. I still remember that those days, there were relatives of mine who used to come and ask me that, what are you being a computer engineer doing in healthcare, in a hospital?
Yes.
And it was very difficult for me to explain it to them then.
Yeah.
So after working in American Hospital Dubai, I came back, joined Dell Services. It was Pero bought over by Dell Services. Now it is Entity Data. So, and Entity Data was working on a project for digitizing the entire clinical transformation for Max Healthcare Group. They had selected a US-based EMR. And they were having a lot of challenges. And that's when we realized, I was leading that project from an integration perspective and application support perspective. And that's when we realized that, you just can't have a product from US try to fit in the Indian context. The processes and people also have to be aligned with that.
True.
And at that point in time, we didn't have any product which had that EMR or the clinical transformation bit in the system. And that's what led to starting this company. We started in stealth mode. The office was this size.
Okay.
Working in an MNC gives you the flexibility that you can work from home, you can go late. So we used to work on Saturdays, Sundays, and give TrioTree people off on Monday, Tuesday, so that we can spend more time. And that's how it started. So we all came full time in 2012. So my other co-founders, they are also were working in the same project in Dell then, and they are still our partners here.
Okay. So being a clinical person, I am a clinical person, so when there is come word technology, so clinical plus technology doesn't go that much together. So for me, whenever a new technology is introduced to me, I find it very hard to grasp it, to adopt to it. So what kind of hurdles do you face while implementing the HIS system in the hospitals or clinics in India?
So one of the challenges, the HIS is bread and butter now. So primarily automation, the administrative part, the billing, registration, even to a certain extent, the clinical department like pharmacy, radiology, and lab, those are automated. The challenge comes once you get the doctors and the nurses in the value chain.
Yes.
And you want them to use the system.
Definitely.
And whether we like it or not, doctors will always remain at the fulcrum, at the center of the healthcare delivery. And that is where the entire challenge begins. And like you rightly pointed out, this is less of a technology problem, more of a people problem, behavior problem.
Yes.
And I always say that this is not a technology solution that we are implementing. It is the more of a change management that we have to do for the clinicians. And to circumvent that, first thing that we have to do is to make them understand that this is a problem that will solve their problem. This is not something that this will solve management problem or a vendor's problem or IT's problem. Number one. Number two is that this is not an IT project. Any implementation that you do, you have to onboard nurses, which is the maximum percentage of employees in a hospital, and clinicians. And the constant complaint that we hear is that, oh, for the last 20 years I've been practicing medicine, this is how I do it. Now you want me to focus on technology and less on patients? This is one question that you can't have a counter argument to.
Yeah.
And that's when we try to onboard them onto this implementation, saying that this is not an IT project, but it's a hospital project. It might increase your load slightly in the beginning, but eventually, once the patient comes back, you don't have to rely on the nurses for the entire clinical documentation. You don't have to rely on the medical records. You don't have to rely on the patient to get the files. There have been instances where patient actually stays 20 odd kilometers far. He's carrying a film. He's supposed to carry a film. He comes for an appointment. Doctors will ask, okay, show me your discharge summary or show me your MIR report. And they realize that, oh, we don't have that. So this is also a time wastage for the clinicians, because during that time you would have attended another patient. So onboarding them that this solution will eventually help you is the biggest problem. But if you are able to convince them, then it's pretty easy. And doctors are very fast learners, very fast. They are slow to adopt, but they learn very fast. And they know exactly that in 3 minutes, how do we ensure that the clinical documentation is also done and the patient care delivery is also done. So there are a lot of, and that was the vision why we had started. We did not start just for the HIS. We started because we wanted to implement EMR in the entire healthcare delivery in the hospital in India where the clinicians would be using it. And there are a lot of case studies that we have using our own product. There are hospitals who do close to 3,000 OPDs in a day. A single doctor sees around 60 to 100 patients in a day, and they are doing 100% in the system. So that is what, that's what the vision was when we had started, and it is bearing fruit now. Thankfully in India, this government is also very focused on the automation or the digitization of the healthcare, the ABDM, which was NHDM earlier. That is a transformation that is happening in healthcare. And I truly believe that this is the most right time, most apt time to be in the healthcare technology space in India for sure.
So definitely, for a patient, from a patient perspective, I can truly, understand, bringing your reports to the hospital. Sometimes you miss that. Sometimes, it's being kept somewhere. So it delays the treatment, and it delays wastage of time for both patient and clinician as well. So since you mentioned about the government initiatives, ABDM and other digital initiative, so what one advice would you like to give to the government of India in this, they are working in this space? What one advice would you like to give them?
Okay, so first thing first, we have to understand that India as a country is a huge country.
Yes.
We have, 140, 140 crore people, and we have to manage healthcare for everyone.
Yes.
But that also essentially means that there is a lot of opportunity there because of the economy of scale. lot of other other countries that we have seen where, like Dubai, yes, it is a relatively smaller country to manage, but we can see that there is a common population health is very easy because all the public and the private hospitals and clinics, they are necessarily mandated to transfer all the clinical information related to their citizens online on a real-time basis. Essentially what it does is, so if a patient moves from a facility one, which is a public hospital, to a private hospital to a private clinic, the entire record, the entire EMR is actually stored on centrally by the government.
So we are talking about EHR?
We are talking about EHR, centralized EHR.
Centralized EHR.
And making the public hospital as well as the private hospitals part of that. So that is one thing that the government needs to, and that's what the entire journey of ABDM is.
Yes.
Health being a state subject in India, it makes the implementation of ABDM slightly difficult. But like I said, I mean, now the government for the first time, they have come for an incentive for vendors like us.
Yes.
If we create a health ID on our platform, government has incentivized us with a small token. So this is the first time that has happened. And so that would be my suggestion to the government, to ensure that at least there has to be a central repository of entire EHR of the citizens of the country. And then government would be able to use this data, to churn this data, to know what is the kind of population health is and which sector needs to, I mean, where the government needs to spend more, whether it is obesity, whether it is diabetes, whether it is other chronic care diseases. They can only get to know if they know, I mean, what are the diseases, what is the population health of the country. So that would be my suggestion.
So since the government is doing so much, but we have also talked about the records, the electronic health record or electronic medical record. So since when there is a patient and hospital, there is a data. So there must be some concern about the patient safety data regarding, like, although in India also people, like most, I guess, people still don't have Aadhaar ID. So how the TrioTree or the other healthcare technology companies should be looking after the patient data safety security? How we can
Yeah, so I'll break this into two. One is data security, other is data privacy.
Yes.
So first thing first, data has to be secure. And second is data has to be private. What essentially that means is it should be secure, that no one should be able to access it. Number two, even if somebody has got the right to access, the privacy should still be maintained. So only right kind of people should have access to, and only with the right kind of information, right?
Yes.
So, I mean, thankfully, again, I'll talk about ABDM. So ABDM platform works on FHIR. So FHIR as a technology itself gives you a lot of security. Now government has come up with a DPDP Act also.
Yes.
So all of these combined is ensuring that the data is secure, plus the data privacy is also taken care of. There's a hefty fine if you default as per the DPDP Act, almost 250 crores per instance of default that you do, which is exorbitant. But I believe that government is also rightfully very focused on data privacy, and hence they have made this kind of fine. We as an organization, we at TrioTree also, we also understand. So I'll also give you a background to this. When I was in American Hospital Dubai, there used to be a thing that we used to call as mumps the word. Means if you go around the hospital, you should keep your mouth shut. You should not even discuss the case studies, even in public places or in restaurant or in canteen, because you don't know who is sitting there.
Definitely.
So this is somehow has been ingrained with me for the last 20 years now. And we as a technology provided to the hospitals, and also as a habit, as a culture, we ensure that the patient data is very confidential.
Yes.
One of the things that we also do this while we onboard any new employee at TrioTree is that we tell them that we are in such an industry, whether we like it or we don't like it, at some point in time we all would be patients.
Yes.
Which is, it's not that I'm wishing for anyone, but we
that's
all,
the truth, huh?
that is the truth.
Yeah.
And hence, whatever we do, we should realize at that point in time that if this happens to us, how would we take it? If our data or my family's private data gets public, how would I react?
Yes.
And hence, that as a culture we have ingrained in the solution that we do. And as part of TrioTree, we also onboard a lot of hospitals, not only where we implement our solution, we take over the entire IT. So where TrioTree becomes the IT arm of the hospitals. And all those places, this is exactly what we say, that technology is only enabler to ensure that data is safe, it is in the right hands, and at the right time.
Yes. So as we are moving towards new technology, new future. So there is AI, cloud computing, telemedicine, all of this, and I'd like to understand how what all new technology is coming in this field of healthcare technology. This which is new, like it is same AI or cloud computing, or something new is there other than this?
This is an industry which is constantly evolving.
Yes.
Telemedicine has been in this country for the last 20-30 years.
Yes.
And like I said, India is a country of various facets where you will get a hospital like HN Reliance or a Medanta or a Max or a Fortis. At the same time, you have facilities of ESI hospital, you have AIMS as well.
Yes.
And you have to cater to the entire diverse population of the country. You have to deliver healthcare in the terrains of Northeast as well as in the deserts of Gujarat.
Yes.
That is what the expanse of this country is. And hence you cannot have one size that fits all.
Yes.
Telemedicine and remote patient care. One of the challenges that we as a country are battling with is lack of skilled manpower. And because there's a lack of skilled manpower and our population is increasing, we cannot deliver. Our infrastructure is not sustainable to cater to the entire population. So only way that we would be able to do it would be through technology. So I'll consider telemedicine and remote patient care. See, the challenge in India is that on one side we say that the occupancy, that the patient don't fight bed. On the second thing, we also say that there are a lot of hospitals where the occupancy is not 100%. So they're having their own challenges to be sustainable in the economic front. And the issue is because if you look at the Indian culture, ideally if you go abroad, you'll find that there's a primary care, secondary care, tertiary care.
Yes.
In India, because people who can afford, they can directly go to the tertiary care hospital.
Yes,
you don't need to go there,
but
because you can afford, you go there. But then that essentially means is that slot we ideally could have given to someone else who needs it, but because of your money power you go and attend, and that can be solved if we efficiently manage the remote patient care monitoring, where you only go to hospitals when it is needed, or else you are safe in your house. And government did it during COVID. This is exactly government did. But post-COVID, the lids were open, and also, I mean, the entire priority and focus went to something else. So, I mean, my sincere is I'm looking up to remote patient care in a big way. It will change healthcare for sure. We have started doing it. I'm diabetic. I actually use Apple Watch to look at, I mean, what my essential vitals are, how is it, am I behaving? It automatically syncs to my health record. I can look at the entire trends. There's nothing but remote patient care. I am not necessarily in a hospital to do that. So care has to come out from the hospitals or healthcare providers, and it has to go in the hands of the patient wherever he or she is. That is the change in technology that I'm betting big on.
Okay, so that's what your vision as well for the future of India.
Oh yes, it is, because otherwise, this bigger population, it's not possible to manage with this kind of infrastructure that we have. And if you know, we have one psychiatrist for every 15 lakh of citizens that we have. It's not sustainable.
Yes.
And the thing is, the healthcare delivery has to become affordable, has to become accessible.
Yes.
And you can do both of these when you bring the cost down. And the cost can only come down using technology. You cannot replicate a doctor suddenly in next 5 years, 10 years, though the government has put the focus on in this budget to open new medical colleges. But suddenly that will not happen. It will take 10 years, 20 years to become self-sustainable.
Yes.
So in next 20 years, only technology is the thing that will take us there.
So thank you so much, sir, for such an insightful discussion, and we have a lot to do in the field of technology, and especially in the for the rural healthcare infrastructure and rural people out there. And thank you to our listener for tuning into the episode, and we hope to bring you such more insightful episode in the coming months. Thank you so much.